Hi everyone, welcome to my channel Dr. VENUMADHAV's Learning Anatomy. In this channel, I will present continuous videos of different chapters of anatomy which are usually useful for the newly joined medical graduates and those who want to learn anatomy. And I will try to explain the anatomy somewhat in a easy terms, and I would like everyone to like my videos, to subscribe my channel, to share to your friends and make them also to subscribe. And also please click the bell icon so that the notifications of the new videos may reach you early. In the today's topic is the terms which are commonly used in anatomy. The anatomy is a vast subject where different terms are used to describe the body parts and different relations are used. So in this class we discuss about the common terms and the basic terms. The detailed topics or any special terms we can discuss during the specific classes. So what is anatomy? Anatomy is the branch of science that deals with the study of the structure of the organisms, including their tissues, organs and their body systems, both macroscopically and microscopically. And this also includes the embryology, genetics, histology, etc. The word anatomy was derived from the anatome, which means to cut up or to open. So anatomy is learned by cutting or studying the body part by part or layer by layer. This is usually done in the dissection halls, and nowadays the virtual platform is available where with the help of computer we can create a virtual image of different layers and different parts of the body either on a screen and on a projector, so that we can understand the normal anatomy without disturbing any cadaver. The anatomy is very important because it is the basis for all living processes or the metabolic processes which are for health, and also the disease processes also occur in the body. And all branches of medicine depends on anatomy. Without knowing proper anatomy, the surgery, physiology, biochemistry, microbiology, pathology, gynecology, obstetrics, everything we can't understand easily. We see different branches of anatomy today. This is surface anatomy, deals with the study and the markings of the surface of the body. Gross anatomy deals with the study of the structure that can be examined by the naked eye. Systemic or systematic anatomy is the study of the body systematically or by different systems like skeletal system, digestive system, etc. And regional anatomy is the study of the body by region wise, that is head, neck and thorax, etc. Radiographic or radiological anatomy deals with the study of the body by using radiological techniques like MRI scan, CT scan, etc. Developmental anatomy deals with the study of an organism from egg to the adult form. Everything is included here. And the embryology is the study of an organism from egg to the 8th week of intrauterine life. After 8 weeks of intrauterine life, we call it as fetus. Cytology deals with the study of the structures, cells, and histology deals with the study of the tissues. Now, few more branches are there. The clinical anatomy deals with the clinical changes that occurs in the structure of the body during a disease. Pathological changes in a tissue of the body during a disease are called pathological anatomy. And genetics is the study of chromosomes, genes, genetical inheritance, and the genetical disorders. These are all involving genetical changes are studied under the heading of genetics. Physiology deals with the functional aspects of all anatomical structures. If we observe a human body or any life, it starts by means of a single-celled zygote which divides repeatedly to form germ layers from which tissues are formed, and the tissues unite to form an organ, and different organs concerned with specific function unite to form a system, and different systems comprises the human body or an organism. So today we will have a basic introduction to the human body again. You all know the human body for the purpose of study can be differentiated into a head and neck region that is above the level of the collarbones. The trunk consists of the thorax and the abdomen, which are separated internally by means of a diaphragm, and limbs, upper limbs and lower limbs, which are connected to the body by means of a pectoral girdle and a pelvic girdle. Details of these things we will study when we go through that chapter. Now we start the terms of position of the body. Any part or region of the body are described assuming that the body is in a specific position called anatomical position. Even though you are holding an organ and studying it with the organ in a lying down position, but the description is given as if it is in the anatomical position only. What is anatomical position then? The anatomical position is, this is the anatomical position where the subject stands erect. That means the subject should be in a standing position. Face and eyes are straight towards the observer. Hands hanging at sides of the trunk with palms facing towards the observer, and feet lying flat on the ground. This is the front view and this is back view of the, two views are here. This is the front view, back view of the anatomical position. So even the cadaver or the part is kept on the table lying down in either in supine position, lateral position, whatever may be that. The description of particular organ is given as if it is in the anatomical position. This is the supine position, that is lying down on the back, and that is also called recumbent position with the face directed upwards, hands on the sides. Prone position, lying down on the abdomen with the face directed downwards. This is also called as procumbent position. This is the lithotomy position, generally used during normal labor and the procedures at this anorectal region. This is the anorectal region where the subject is lying supine with hips and knees fully flexed and legs are wide apart so that the perineal region is seen. So hips are flexed, that means from here hips are flexed, they brought near the body. Knees are flexed here, this is the flexion, and two legs are separated somewhat so that this region is clearly seen. This is done during procedures on that region. So another position is there, left lateral position. We use in the OP department to observe the anorectal regions where the subject lies on their left hand with body turned to left side, left leg is extended and right leg is flexed. That means this left leg is kept straight, right leg is flexed at knee, so that this region is observed where the observer is standing on the back of this patient. This is called left lateral position. Now we learn some terms related to the planes. A plane divides the body into two parts, maybe right and left, maybe front and back, maybe up and down. Usually this is an imaginary plane, and usually for the purpose of the study of the body or a part, layer by layer, useful in CT or MRI scans nowadays, because those films are taken in different layer by layers. So this is about the planes. So what are the common planes? Median plane or the mid-sagittal plane. It is a vertical plane that divides the body into a right half and left half, a vertical plane. And this should pass through the sagittal suture. This is the sagittal suture from here to here. This is the sagittal suture between two parietal bones, and this passes exactly through the sagittal suture. So that is called mid-sagittal suture or median suture or median plane, mid-sagittal plane or median plane. Now, any plane parallel to this median plane is called paramedian or sagittal plane. So sagittal plane also divides the body into right half and left half, but not not into equal halves. This median plane divides the body almost into right and left equal halves. Coronal plane or frontal plane, a vertical plane that divides the body into an anterior half and posterior half, and a front half that is and a back half. And this is parallel to this coronal suture. This is corona, like a crown. So this is coronal suture. This is sagittal suture. So this plane passes parallel to the coronal suture and right angle to this sagittal suture. You can see this is the sagittal plane, this is the coronal plane, and another plane here is the transverse plane, which is dividing the body into an upper half and lower half. The transverse plane divides the body or a part at right angles to its longitudinal axis. Here, this is the longitudinal axis, and this divides right angle to that longitudinal axis. That's where a upper half and a lower half are formed. Another plane is there, horizontal plane, sometimes we use it. A plane that passes through the body or any part of the body which is just horizontal to the ground level. It does not bother about the longitudinal axis of the body or the part. It is just horizontal to the ground level. If we cut, that is a horizontal plane. Oblique plane is different from transverse and horizontal plane and runs in a oblique direction. You can see terms of relation in gross anatomy: anterior towards the front side, posterior towards the back side, superior towards the head or the upper side, inferior towards the legs or downwards. Medial is the term used towards the median plane, towards the center of the body, and lateral means the word is used to denote the topic which is going away from the median plane. You can see here, this is anterior side, this is posterior side. Towards the head is the cranial side or the superior side, caudal side. Inferior side is towards downwards. From here, if we are going away, that is towards the lateral aspect, and from here we are going this side, that means that is medial aspect. Right and left sides are there. Proximal is nearer the body, distal is away from the body. Here in the lower limb also proximal and distal. So these are the terms which are usually used. Here the terms of relation in embryology, sometimes used in gross anatomy also. Those are the ventral side, this is the ventral side, dorsal side, caudal side and cephalic side. These are the terms which are initially observed in the quadruped animals, where the animal is walking by 4 legs. So the surface which is towards the sky is the dorsal surface, and towards the earth is the ventral surface, and towards the head is the rostral or cephalic side, and towards the tail is the caudal side. When gradually during development the quadrupeds become bipeds, so when we attain our erectile position, the ventral side become the anterior aspect, whereas the dorsal side become the posterior side. If we see, just we mentioned, the proximal part is nearer to the trunk, distal part is away from the trunk. Radial side is the outer border in the upper limb towards the thumb side, and ulnar side is the inner border in the upper limb, that is little finger. The outer border, inner border are mentioned according to the anatomical position. The thumb is on the lateral aspect in the anatomical position, that is radial side. Again in the lower limb, tibial side is the inner border of the lower limb towards the great toe, whereas the fibular side is the outer border in the lower limb towards the little toe. The tibia bone is present in the leg towards this side, and fibula is present on the lateral aspect. So preaxial border and postaxial border. The outer border in the upper limb and inner border in the lower limb are called preaxial borders, whereas the inner border in the upper limb and the outer border in the lower limb are called postaxial borders. Axial lines are mentioned during development where the limbs after formation they rotate along this axis. The axis in the upper limb passes through the middle finger, whereas the lower limb passes through the second toe. These are different parts of the body, our limbs. You can see if we compare, this is humerus, this is femur, pectoral girdle, pelvic girdle. Here this is femur, elbow, knee joint, radius. This is the radius towards the thumb side, ulna towards the little finger size. Likewise, towards the great toe side, it is the tibia. Fibula is on the lateral aspect. Flexor surface, the anterior surface in the upper limb and the posterior surface in the lower limb, where we can bend our elbow. So this part is the flexor surface, and opposite to is the extensor surface. That is the posterior surface in the upper limb and the anterior surface in the lower limb. Then palmar or volar surface is towards the palm or the hand, whereas the plantar surface is towards the sole of the feet. Dorsal surface is the term commonly used to describe the back of hand or the upper aspect of the foot. Even though we show our hand like this is the dorsal surface, this is the ventral surface. It doesn't matter in which direction you keep your hand, but we have to describe the terms according to the anatomical position only. You can see this is the flexion. Here it is going towards, this is the flexion, and from here it is coming down, this is the extension. So we are bending the elbow, that is flexion, extending the elbow, that means we are keeping it straight, that is called extension. This is at the wrist, flexion of wrist and extension of wrist. Again, this is the extension of the knee joint here, and this is the flexion at knee. If we take any hollow organ, it will have a cavity and a wall. So the surface near the cavity is the inner surface, where the surface away from the cavity is the outer surface. So this is also called interior surface or the exterior surface. Invagination, anything that protrudes inside towards the center, that may be seen in a hollow organ or in a solid organ, that may contain a canal or may not contain a canal, that is called invagination. Whereas coming from outside from the surface is called evagination. Terms for solid organs. Again, superficial surface towards the outer surface, deep surface towards the central core. Terms indicating side, that's what we mentioned earlier, the anterior, posterior, inferior, superior, right, left. These are all terms indicating side only. But there are specific terms in certain topics where the terms will be ipsilateral. We see these terms usually in the nervous system. So ipsilateral, that means they are the whatever are described are on the same side. Contralateral, that means to the opposite side. So decussation is another term we commonly see in anatomy. So the decussation means to cross from one side to the opposite side. The best example is the pyramidal tract, where we see the corticospinal fibers cross from right to left side and left to right side. Now we see the terms related to muscles. Muscle is the word derived from the word musculus, means a little mouse. The body of the mouse represents the belly, where the tail of the mouse represents the tendon of the muscle. So this is the belly. You can see the fleshy and contractile part of the muscle where the fibers are seen, and the tendon is the fibrous part. This is the tendon. The tendon is usually non-contractile and usually joins the belly with a bone. Usually the muscle will have an origin point and an insertion point. Both sides you can see the tendons, a little bit tendons, but usually this part is immobile, where if the origin of this muscle is here, the origin point is usually immobile, where the insertion point is mobile. Sometimes it may change. This is about the tendon. A tendon is a fibrous connective tissue that attaches muscles to the bone. Tendons may also attach muscles to structures such as eyeball. So a tendon serves to move the bone or a structure. So whenever the muscle with its belly contracts, the tendon pulls the bone to bend at the nearest joint. Aponeurosis. If the tendon usually will be a cord-like structure, if it is flattened and wide, that is called aponeurosis. The best example is epicranial aponeurosis of the scalp. Few more aponeurosis can be seen. We will discuss in appropriate chapters. Raphe is a fibrous band formed by the interdigitating fibers of tendons or aponeurosis. It is stretchable, and the muscles also fibers intermingle to form a raphe. This is the best example. Pterygomandibular raphe extending from the pterygoid plate to the mandible. From its anterior surface, the buccinator muscle arises. From its posterior surface, the superior pharyngeal constrictor muscle arises. The fibers of both muscles interdigitate to form the pterygomandibular raphe. All the pharyngeal constrictors, they turn on the back side of the pharynx to form another pharyngeal raphe. There are another structures which are seen around the joints. They are tough elastic bands, and they hold the joints and also limits the joints. These are called ligaments, and they connect bone to bone, gives our joints support and limit their movement, usually encloses a joint space. So as we mentioned, these are the terms of movement: flexion, extension, and this is the abduction, adduction. Abduction means, for example, in this section, the hands are moved away from the body. That is called abduction. So any two parts which are separated from each other is called abduction. And here the adduction, the hands are brought near the body. Adduction, abduction. Now you can see turning the palm. If this is the hand is like this is called supination. If we turn like this, that is called pronation. Like in the foot, if we turn the foot towards the great toe side, that is supination. And if we turn the foot with the little finger coming upwards, that is called pronation. Protrusion means forward movement of the any structure, and retraction means backward movement. And this circumduction is the mixture of abduction, flexion, extension, adduction, etc. So in the different movements unite to bring a circumduction movement, best seen in during the bowling in the cricket game. So according to the functions, flexors causes flexion, extensor causes extension, elevators or elevators causes elevation of the attached part. It is also known as elevation also. Example is elevator, veli palatini. Okay. So depressors, the name itself says, causes depression. Rotators cause circular motion. Supinators cause supination. That means those muscles which help to perform, this is the pronated area. So the muscles which help to supinate our hand are the supinators, and pronators causes pronation. Tensors causes tightness, whereas sphincters regulate an orifice. So best sphincter we'll see is the anal sphincter, and the sphincters around mouth all are present in our body. You can see based on the number of origins and appearance. At the origin, if the two heads are present, that is called biceps, and these are the examples of those muscles. And the triceps having three heads, Quadriceps having 4 heads, strap muscles, long, slender and flat muscles. Serratus, sawtooth-like. One of the examples is serratus anterior and other is serratus posterior. Longus, that means the muscles are long. Example is abductor pollicis longus. Brevis, short. Abductor pollicis brevis. So abductor, it abducts the pollicis, that is the thumb. Longus, and the muscle is long. This muscle is short. Splenius, it is, the meaning is bandage like, and it is, example is splenius capitis and splenius cervicis. According to the shape and size, zygomaticus major, that means a bigger muscle. Zygomaticus minor is a smaller muscle. So when two or more muscles are present from same origin and same insertion, so then according to the size, they are named as major and minor. Teres, round and cord-like. Teres major and minor are examples. If the name is name consists of a term called dorsi, that means that muscle is present on the dorsal aspect. Rectus, it is straight and longitudinal. The example is rectus abdominis. Obliquus, obliquely oriented fibers you will see. Transversus means where the fibers are transversely arranged. These are the terms used according to the shape and size of the muscles. So after completion of terms about the muscles, we will see the terms for the vessels. Arteries, they are named as arteries because they carry blood away from the heart. Usually carry oxygenated blood except the pulmonary and the umbilical arteries. So the umbilical artery is named according to the fetus. That's why it carries deoxygenated blood from the fetus to the mother. Whereas the pulmonary artery carries deoxygenated blood from the heart to the lungs. Smaller arteries are called arterioles. Veins usually carry deoxygenated blood. Veins are named to the vessels which carry blood from the other parts of the body to the heart. The pulmonary vein and the umbilical veins carry oxygenated blood. The pulmonary veins carry the oxygenated blood from the lungs to the heart, whereas the umbilical vein is named according to the mother, where that carry oxygenated blood from the mother to the baby. That's why the umbilical vein and the umbilical artery belongs to the fetus. They carry oxygenated blood. So smaller veins are called venules, and capillaries are the network of microscopic vessels which connect arterioles and venules. Anastomosis is the communication between neighboring vessels, and lymphatics are also vessels. They carry lymph, beaded in appearance. You can see these are the blood vessels, these are the arteries, veins. This is the anastomosis between capillaries, and here it is the lymphatics. The beaded appearance is there, and these are the lymph nodes which are present among the lymphatics. Details we will see when we see the blood vascular system. Now coming to the bones, we will see number of features on the bones due to the attachment of muscles, passing of blood vessels, and the neighboring structures. The bone itself has a large cavity, so the terms which are related to the bones are divided into, for description purpose, we can learn as elevations. The elevations are, if the elevation is linear, that is called line, linea aspera of the femur. These are the examples where we see those things. The elevation may be a line, a lip, or a ridge, or a crest. If the elevation is sharp, it is pinpointed sharp, that is spine. If it is somewhat long, that is styloid process, and a cornua or a horn, hamulus. So these are all where we see these sharp elevations. Spine of sphenoid, styloid process of the temporal bone, cornua or horn of hyoid bone, hamulus of the medial pterygoid pad. It is, hamulus is hook shaped, and you can see here. So you can see number of elevations here are there. This is the linea aspera, linear elevation. This is an elevation, greater trochanter, lesser trochanter. There is a groove here, intertrochanter groove. on either side of the groove are the lips. Here you can see the condyles, and a notch is there, a fossa is there here, epicondyles are there, these are the epicondyles. So rounded or irregular elevations may be a tubercle, tuberosity, depending on the size and shape. Epicondyle, condyle, malleolus, trochanter, these are all rounded or irregular elevations. Ramus is a broad arm or projection from the bone. You can see depressions are also seen on the bones. If depression is very little, that is called pit. If it is caused by the in other structure which is passing very close to the surface of the bone, that is called impression. And fovea is somewhat larger depression, fossa is somewhat more larger, depending on the size only, width and depth. So groove means a sulcus or a notch. Notch is somewhat U-shaped, or a large depression will be there. So that is the notch, and that allows other structures to pass through it. The openings may be a foramen, canal, hiatus, or the aqueduct, depending on the length of the canal formed. Cavity is a large cavity within a bone, is a sinus or antrum, or cells, or medullary cavity. These are all we will see while we study the paranasal sinuses, mastoid antrum, mastoid air cells, and the medullary cavity consists of medulla of the bone marrow. So if the articular surface is the surface which forms joint, the smooth articular surfaces may be a facet. That means depending on the size, if it is very small, a facet, condyle a little bit larger, head, capitulum, or trochlea, depending on the size and the shape of the articular surface. When we study individual bones, we can understand each and everything. I will show you on a real bone. So with this I conclude here. Once again I request everyone, please like my video, subscribe and share it to your friends. You can find more on my YouTube videos of anatomy by searching Learning Anatomy by Dr. VENUMADHAV. I already made few videos of head and neck region, and now from today onwards I am going to make all videos of each and every chapter. Thank you very much.